Alex Ogundipe is the Director, Community Prevention and Care Services, National Agency for the Control of AIDS, NACA. He joins us live on the news at 7. For more updates on this development, some 1 month ago, we were told that 1.9 million Nigerians living with HIV have access to free treatment. First, is that figure accurate as per HIV prevalence in Nigeria? And how close are we now to achieving epidemic control?
Pardon me, sorry, I can't hear you very well. Thank you for inviting us. Please, can I hear you? Can you repeat the question?
I'm asking if the 1.9 million figure is accurate and how close the country is to achieving epidemic control.
Oh, thank you very much. It is correct that Nigeria presently has about 1.9 million individuals living with the virus. Of this 1.9 million living with the virus, we have been able to locate and identify 1.7 of them, and they are all on treatment, and they are doing very well. We just have to locate the rest within the population and keep them on treatment, and the treatments are working very well. And once they stick with their regimen, we are sure that before 2030, we will be able to control this virus.
Talking about treatment, Mr. Ogundipe, when a person living with HIV, he's on drugs and the viral load is low, is it safe to have unprotected sex without passing the virus over?
Thank you again, and that's a very good question. Once people are on treatment, and once they keep their treatment regimen accurately and they're taking it well, and they're very simple these days. In earlier times, people used to swallow drugs frequently and many drugs, but now it's been reduced to just 1 or 2 tablets a day, and it makes it very simple. When you are on these drugs and you keep to the regimen, we can suppress your viral load properly, and such individual can live a normal life, have sex with their family, with their wife, and even produce children that are not positive if they're still producing children.
Nearly 40% of new HIV infections, we are told, are transmitted by people who do not know that they have the virus. What's been done to deal with this challenge of undiagnosed HIV to be able to stop, new cases?
Thank you again. And that is the challenge that we all have. And that is why this year World AIDS Day celebration has been tagged, equalized. We recognize that there are certain barriers that still keep people not knowing their status. One of it is the legislations, the environment that is hostile, legislations that do not allow men and women to access services. Another of such barrier is the stigmatization that individuals also stigmatize themselves. Women are more likely to even access services than men. A lot of us men manage our health condition. We are very reluctant to visit facilities. It is all of this that is making us challenge ourselves, that we need to equalize access to prevention services as well as treatment services. And we need the help of everyone. First of all, not to stigmatize people. Secondly, the healthcare facilities, healthcare workers need to be more friendly to adolescents, to women, to men, to encourage them to access services, as well as we are appealing to managers of facilities, particularly government at subnational level. And I'm talking about local government, general hospitals. We are appealing to ministries of health to remove what we call the things that have been barriers. People are paying user fees. They need to pay certain fees to access certain services. Yet, the the whole gamut of HIV treatment is free. And so we appeal that if we can remove most of these barriers to treatment, to accessing services, we will be able to get these individuals that are still in the community not knowing that they are infected and they are still spreading the virus.
Indeed, Alex Ogundipe is Director, Community Prevention and Care Services of the National Agency for the Control of AIDS. Thank you for talking to us in the news tonight.
Thank you very much.